And I have the benefit of sitting down and seeing what these molecules look like and trying to make sense out of the molecular structures and trying to see, basically pick the winners and figure out which one is going to be the best, right? So I get to see all of the good news that happens in here. I get to see all those. Those are the hits. We call them hits.
Dr. Jonathan Sexton is searching for a winner, a better treatment for diabetes. And he hopes to find it by working with 460,000 molecular compounds preserved in freezers at North Carolina Central University.
Then we do a medicinal chemistry evaluation. We say, do these molecules look toxic, or do they look, are they soluble, are they insoluble? They have all these properties that we have to consider, and these properties are what go into making a good drug.
This is NC Central's BRIGHT Center. It stands for Biomanufacturing Research Institute and Technology Enterprise. For the past 6 years, Sexton and his team have worked to develop a drug treatment for non-alcoholic fatty liver disease. It's the most chronic liver disease in adults and children, and one that affects the majority of patients with type 2 diabetes.
So what we do in this laboratory is we'll take cells from a human liver and we'll plate them in dishes called 96 or 384 well plates, and then we'll add a potential drug. So this is a drug-like molecule that we can add to these liver cells to see if it has a positive effect, to see if it has a negative effect, toxicity, or if it has no effect at all. And the vast majority of compounds have no effect at all. And what we're doing is we're looking for that needle in a haystack to find that one compound that has that therapeutic benefit for human liver that we can then carry forward into drug development and ultimately into clinical trials so we can make an impact in improving human health.
And technology is key to this needle in a haystack search for a new drug. The process is called high-throughput screening. Using robotics, sensitive detectors, and data processing, potential drugs drawn from those frozen stored compounds are mixed with liver cells in the plates. The results of the interaction provide a starting point for drug design.
We're using human cells and human tissue as the platform for drug discovery. Now, that being the case, we need to actually look and assess the human cells and see how they're doing.
And that interaction can be observed at the cellular level using a fluorescence microscope. In the Liver Project, researchers would observe the amount of lipids, or fat, in liver cells. Remember, liver cells that are resistant to insulin is the issue with type 2 diabetes. But this is the pancreas, which produces the insulin.
These are human beta cells, so these are the cells in your pancreas that are responsible for making insulin. And what you'll see here is that...
So these are individual cells?
They are individual cells. Each one of them is an individual cell. And if you can see this granular pattern here, these are basically spots. And these spots that's actually insulin. So those are little granules of insulin, and you can move around and find regions that have an incredible amount of insulin.
Insulin is a hormone that controls blood glucose levels. The pancreas releases insulin into the blood whenever blood glucose levels spike. That's usually after a meal. Type 1 diabetes is the condition where the pancreas doesn't produce enough insulin. Watch the change after a meal.
So these cells have released their insulin.
Okay.
And you can visually see what the difference is.
So after a meal, this is what it should look like.
Depleted, yes, yeah. But you notice there's still kind of a big pile in the center of the cell. So that's called the replenishment pool. So this is the insulin that is going to the front lines. And so it's not ready to be released yet, but it will be in about 20 or 30 minutes. They'll be back to normal.
So this is new insulin being made?
This is freshly synthesized insulin, yes.
And so far, the technology-assisted needle-in-the-haystack search is working. Researchers have discovered several compounds that are showing promising results in tests on mice. The work is personal for senior Alex Beasley, who won his battle with diabetes.
I mean, the reason why I got it was because I weighed a lot. But I have friends who are diabetics who are, regular size. They're not obese or anything. So it's like if you can find a way to help them out, I mean, it's not their fault that they're diabetic. They have to have shots, do all that stuff, anything that can, help people out.
NC Central's Bright Center is on the cutting edge, not only of science, but also of drug development. That's because through the years, pharmaceutical companies have come to rely more and more on academia, on centers like this, to not only discover new drugs, but also perform the early stage testing of the drugs.
Human health, especially in America, is declining, especially with the obesity epidemic and type 2 diabetes epidemic. And this is a big unmet medical need. And there's no curative therapies now. This is more of a brute force approach. High throughput screening is a brute force approach to discover small molecules that are interesting. And then we have to go back and do more of that rational drug design. So it's really just provides us a starting point to ultimately, developing drugs, new drugs.